Hey YouTube, this is Tara. It's Sunday, August 4th, and this is my update video. Okay, so I've had a lot going on as of recent. As most of you know, if you follow my videos, I've been having issues with back pain horribly. And I was actually hospitalized 2 times this week. I just got released from the hospital yesterday, and I was in hospital from Tuesday to Wednesday, and then I left. I had to because I didn't have anybody to stay overnight with my dog. And then I stayed out of the hospital Thursday, and then Friday I had to go back to the hospital. So just to kind of tell you guys what's going on, I had a CAT scan, an MRI, and an ultrasound done of my abdomen, and basically they concluded that I had gallstones, which makes sense because the pain that I'm having is in the back right side, and it feels like somebody's grabbing underneath my rib cage. And I also had a weird, as of like 3 days ago, I started to get this really weird burning feeling in the upper left quadrant of my stomach. But that wasn't severe enough to the point that I had to go to the hospital. What caused me to go to the hospital is I've been throwing up for 4 weeks now, actually 5 weeks now. And I went to go see my bariatric surgeon at Hershey, and he scheduled me for a gallbladder removal surgery because I've been incapacitated to the point where I can't function, like for the past 4 weeks. And he scheduled me for the gallbladder removal surgery on August 15th, but he actually went on vacation. So he's out enjoying himself and living life to its fullest, and I'm in bed every day in excruciating pain to the point where I can't get out of bed. I couldn't walk my dog. It's really been shitty. So he's off on vacation, and I've been to the ER 7 times this month. Out of the 7 times that I was in the ER total, the last 2 times that I was there, they hospitalized me. They did an EDG, I believe that's what it's called, and they went down into my throat, into my pouch, and they discovered that I had a duodenal ulcer. That the surgeon that did the scope said it was huge. And I said, well, what could cause something like this? Well, the first thing, of course, naturally, that anybody is going to say, well, do you drink? The honest answer to that is I do drink occasionally. Not very often. I'm not really a big drinker because I don't really like how it makes me feel. I might have a couple of drinks socially, maybe once every 3 months, but not to the extent that it should cause any type of ulcer. The other thing they ask is, do you smoke? Well, the honest answer to that is yes, I have resumed smoking. Do I believe that that is the sole cause of having this ulcer? Absolutely not. To tell you a little bit, well, they're convinced that me smoking has caused this ulcer. I don't believe that. For 12 years, I was on ibuprofen, 800 milligrams, that was prescribed to me by a physician because they didn't know what was wrong with me. Nobody's going to listen, to a 12-year-old girl when they have period issues. They think, oh, they told me that I was crazy. They told me it was in my head. They told me I was making it up. I went through 18 different doctors in a total of 12 years. And out of the 18 doctors, one doctor was able to diagnose me and tell me what was wrong with me. And the only way that they were able to do that was through a surgery. And I ended up having a supracervical hysterectomy because of it. I had endometriosis. As a result of me I used to take 800 milligram ibuprofen. I would take 6 or 7 at a time, multiple times a day, because that was the only way that I could function. Ibuprofen can eat a hole in your stomach, and there is warning labels now because of that. It is, to my opinion, that I believe that is what caused this ulcer, not smoking. I'm not saying that smoking maybe didn't assist in that, but smoking solely did not cause the ulcer. So basically, I went into the hospital on Friday, and they said that I needed to be there because I needed to have very strong IV medications for my stomach, since I've been throwing up and I haven't been able to keep anything down. I lost 10 pounds in about 5 days. which sometimes, that's understandable because I had gastric bypass surgery, but not usually that fast. So I haven't really been eating or drinking a lot. Um, so I was in the hospital Friday night. They said I needed to be there. They made such a big deal about me having to stay. I had my mom take my dog, and my mom lives like an hour and a half away from me. So she took my dog, and then the next day I met this surgeon that I've never met before. And she is a co-worker of my bariatric surgeon, so she is also a bariatric surgeon. And she came into the room, and she was very rude to me. She said, "Yeah, I'm going to release you. There's not really much we can do for you. You just need to quit smoking because your ulcer needs to heal." And I said, "Ma'am, I don't really feel that the ulcer is the cause of my pain." She's like, "Well, I disagree. The ulcer could be causing me to have some symptomatic issues, but the pain that I'm feeling is in my right side under my rib cage, and that is where my gallbladder is. The burning sensation that I'm feeling in the upper left quadrant of my stomach is the ulcer." And this woman is basically arguing with me, telling me that I don't know what I'm talking about. And she says, and I thought this was pretty funny, she says, and I quote, "Which one of us went to medical school?" Like, I don't like doctors as it is, and I really don't like doctors that think that they're better than me. And she was saying, "Oh, well, I know what it's like to be 24 years old. I'm almost twice your age. You could be my daughter." I don't understand how that's really relevant. You don't know my body better than me. I've went to 18 different doctors in 12 years, and all except for one was wrong, and nobody would listen to me. Doctors make mistakes all the time, and she told me. So I have my gallbladder removal surgery on August 15th, and I've been just like counting down the days, and that's one of the reasons why I keep going to the ER. Hopefully they told me to come in to see if maybe I could get the surgery date moved up sooner. So that was like one of the pluses of me going to this hospital, because that's who's doing my surgery. And that's who also did my gastric bypass surgery. And this woman is like, "I'm going to talk to your surgeon to see if he can push your surgery date back even further than August 15th, or even if he wants to do it at all, because you can't have this surgery." Basically, they said that there is a thin layer of skin, or I'm sorry, not skin, fat. There is a thin layer of fat that is the only thing that is keeping this ulcer from blowing through to the other side of my stomach and keeping my stomach contents from leaking into my abdominal cavity. So that being said, if you have this knowledge, and the doctor referred to it, another doctor that I seen at the same hospital on Friday when I got admitted told me it was a ticking time bomb. If you have this knowledge, why would you not fix the problem before it becomes a really big issue? Because the doctor that came to see me, this bitch, was telling me about how, "Oh, this is really serious and it's only a matter of time." Well, if you know this, why wouldn't you fix it before it comes to that? She's like, "You're going to be really sick, even more sick than you are now." I don't really understand. If you know the problem, why wouldn't you fix it before it becomes an even bigger problem? So, but that's okay, because one way or another, I know that the pain that I feel in my back right side is not coming from a goddamn ulcer. I know that it's coming from my gallbladder. And I'm going to get it taken out one way or another. I don't care what surgeon I have to go to. I don't care if I have to leave this country. That is what is causing a lot of my symptoms. I'm not saying that the ulcer isn't a problem. That's also a problem that needs to be fixed, but so is my gallbladder. So I have two problems: the gallbladder and the ulcer. The gallbladder is probably going to be taken care of first, followed by the ulcer, and if I can, I'll find somebody that'll do both at the same time. The reason that they don't want to repair the ulcer right now, I believe, is they told me that if they do that, they would have to redo the entire bypass surgery. So they're lazy? I guess so. But that's just kind of my luck, I guess. Sorry, my dog is hitting my computer. Anyway, what else has been going on? Well, my weight right now, oh yeah, I didn't say my weight. All right, my weight as of right now is 147. I'm not really sure what my weight was in my last video, because I know it's been a while since I've updated, but I really haven't been doing anything. I've just been laying in bed for like the past 5 weeks now, and not really doing too much. I did go to Gay Pride last week in Harrisburg. That was a lot of fun. Seen a couple people that I knew. Harrisburg Pride is kind of, It's the same people every year. It's the same vendors every year. It's kind of small. I went to San Francisco Pride in 2007, and that was crazy. That had like probably 5 million people. Like, I broke 3 pairs of flip flops in one day from just walking. It was ridiculous, but it was so much fun. Um, Aside from the whole gallbladder thing and the whole ulcer thing, I've been okay. Just taking one day at a time. I'm at this point, I'm very happy with my decision of still getting gastric bypass surgery. Uh, as far as my eating habits, I haven't really been keeping much down. Uh, my main thing is, since I can't keep a lot of things down, I try to like eat popsicles. So I stick to the popsicles. Like, I like Airhead popsicles; those are my favorite. I can't really eat a lot of fruit popsicles because a lot of fruit popsicles have strawberries in them, and I'm actually allergic to strawberries. Oh, and I also found out that I have herniated discs, so that is also a source for my back pain. I don't really know how that happened, but I haven't really been exercising too much lately. I got my cast off finally. Well, actually, I didn't get it off. My dad cut it off because it was kind of interfering with my life, and it really just needed to go. Um, so that didn't probably heal the right way either, but what are you gonna do? Um, hmm. I've been trying to get outside and be more active as of lately. I can't really exercise right now because of everything that's been going on and like me throwing up constantly. But just going outside, little things like taking my dog for a walk, um, stuff like that. But things with Shauna and I are okay. Uh, she's a great girlfriend, and I'm happy with her. Didn't get any more tattoos. Still just working on this. Eventually, well, I haven't really been working on this lately, but probably within the next month or so, I'm gonna get back on it. My friend Christine, she's been staying with me temporarily, but she's gonna be going back to her house soon. And that's been nice to have somebody to converse with because I'm always alone, so kind of a loner. But all right, well that's it for now. I will keep you guys updated. I have a surgery consult on Tuesday with a different surgeon, not at Hershey, to talk about possibly removing my gallbladder and fixing this ulcer that is in my stomach, which is very important to have done so it doesn't blow through and the contents of my stomach leak all over my abdominal cavity. So that appointment's on Tuesday, and I will keep you guys updated as far as my surgeon appointment at Hershey because he could call me and cancel, or I don't know, but I really didn't appreciate that doctor coming to me the way she did. She's never met me in her life. She doesn't know anything about me. And if she did, she would know that I'm not a very typical patient and that doctors have been very wrong in diagnosing me before. And I'm not just going to take a one person's generic answer because I know my body better than them. Yes, I know that smoking is dangerous. Yes, I know that smoking is a risk factor, especially after you've had gastric bypass surgery. But at the same time, it's not like I've continued smoking the whole way through this process. I just recently started smoking again because why do I smoke? Smoking is something that I enjoy. I don't see it as an addiction. I don't see it as a curse. I don't see it as a problem. I see it as something that's socially acceptable. It's not illegal. It's not like I'm doing drugs. It's not like I'm out there, robbing people to get cigarettes or robbing people at all for that matter. So it's not really hurting anybody but myself, kind of, which I don't really think it is. But if I want to smoke, that's my choice, and nobody's going to be able to stop me from doing that. And smoking didn't cause the ulcer. The extended use of ibuprofen did. And any doctor that knows my history would be able to tell that woman that. But she just saw a quick answer and wanted to give it to me and release me from the hospital, even though they were hell-bent on me being there. But I will keep everybody posted. I did make a video when I was in the hospital, but they came in because they had to give me medicine in the IV, and I had to turn off my computer. So I will not be uploading that video because the video was cut short. But it was just kind of the same thing now, explaining the whole situation to everybody. But all right, that's about it for now. I will keep you updated. Have a good day, and thank you for watching. Bye.